Hi Marinus, this is Mohan Das with EFA exit exam questions and answers consolidated 100% pass. I have collected almost all the questions from various sources and it is a 50 rupees challenge. I am going to give you 260 questions and answers. Although some of the topics like heat related diseases and fracture comes under MFA, you can find some of the questions in EFA also. That is why I have included. Not only that, I have segregated the question answers topic wise. So you learn them, 100% you will pass, and once you pass after the exam you can credit 50 rupees. It is a 50 rupees challenge. Introduction questions. Question number 1. To encourage people to help others in emergency situations, most states have enacted laws which protect you as a rescuer from being sued. This is called, answer, the Good Samaritan law. Question number 2. What is first aid? Answer, the first step given to the victim of an accident. Question number 3. First aid is given by the, answer, by the lay people who value life. Question number 4. First aid must be administered immediately to A. Restore breathing and heartbeat, B. Control bleeding, C. Remove poisons. Answer, D. All of the above. Question number 5. First aid is the immediate care for A. Injuries, B. Burns, C. Sprains. Answer, D. All the above. Question number 6. The emergency responder is one link in the chain of services known as the, answer, emergency medical services in brackets EMS system. Question number 7. The goal of medical service is to provide, answer, provide treatment for those in need of urgent medical care. Question number 8. Your role in making EMS system work effectively includes 4 steps. Answer, check, call, care, protect. Question number 9. Which of the following are considered cruel protective equipment? A. Gloves, B. Mask, C. Eye shield. Answer, D. All of the above. Question number 10. How you should react to an emergency? A. Access the scene for safety, B. Estimate the number of victims and call for help, C. Get the first aid kit, put on PPE before helping. Answer, D. All of the above. Body structure and functions. Question number 11. A tissue is a group of like cells working together. Answer: true. Question number 12. Tissue make up organs. An organ is a structure performing a particular function. Answer: true. Question number 13. Blood is a vehicle for the human cardiovascular system. Its major subdivision are the plasma, including red blood cells, white blood cells, and platelets. Answer: true. Question number 14. What is the circulatory system? Answer: the body's blood transporting system. Question number 15. The entire nervous system is divided into two main regions. Answer: the brain and the spinal cord. Question number 16. The skeletal covering for the brain is provided by bones of the cranium. The overall skeletal structure covering the spinal cord is the vertebral column, in brackets spine. Answer: true. Question number 17. The white exterior portion of the eye is called the answer sclera. Question number 18. Which is called the voice box? Answer: larynx. Question number 19. Which one of the following is a function of the skin? Answer: regulation of body temperature. Question number 20. Muscles are attached to the bones by. Answer: tendons. Question number 21. Where does the partly digested food on liquid form go after it leaves the stomach? Answer: the small intestine. Question number 22. The appendix is located in which quadrant of the abdomen? Answer: lower right. Question number 23. The urinary system is also known as. Answer: the renal system. Question number 24. Urine enters the bladder through which structure? Answer: the ureter. Question number 25. The longest, strongest bone in the body is the. Answer: femur. Question number 26. In topographic anatomy, the term lateral means. Answer: away from the midline of the body. CPR. Question number 27. Brain death occurs. Answer: within 8 to 10 minutes. Question number 28. What is the correct sequence for the primary survey? Answer: danger, response, airway, breathing. Question number 29. What does A stand for in the acronym DRABC? Answer: airway. Question number 30. BLS is? Answer: basic life support. Question number 31. The correct sequence of basic life support is? Answer: airway breathing compressions. Question number 32. When you see a victim, answer: check for breathing and for a pulse. Question number 33. What do you, after the breaths go in, for an unconscious adult? Answer: check for sign of life. What do you do? I'll correct that. I'll read that question again. Question 33. What do you do after the breaths go in for an unconscious adult? Answer: check for sign of life. Question number 34. What will be the effect if a person shows the symptoms of drowsiness? Answer: unconscious. Question number 35. What is asphyxiation means? Answer: a state of unconsciousness. Question number 36. Of the following casualties, which would you care for first? The casualty who is? Answer: unconscious and lying on his stomach. Question number 37. The acronym used to assist the emergency responder assessing the patient's level of responsiveness is? Answer: AVPU. Alert, voice, pain, unresponsive. Question number 38. When you see a victim, check the victim carefully for other injury. Question number 39. What is the definition of the hurry cases? Answer: any condition that threatens victim's life. Question number 40. When a victim is not breathing, answer: lay the victim on his back on a flat surface and tip the head back to open the airway. Question number 41. What can cause the blood circulation stop? Answer: a heart attack. Question number 42. If someone suffers heart attack and has ceased breathing, you should? Answer: immediately start CPR. Question number 43. Before giving CPR, you should make sure. Answer: they are conscious or unconscious. Question number 44. Why is CPR important? Answer: it provides a small supply of blood and oxygen to the brain and vital organs. Question number 45. An unconscious seaman is lying on his back and is breathing. What is the first thing you should do? Answer: tilt his head back as far it will go. Question number 46. How should you open the airway of an unconscious casualty? Answer: head tilt and chin lift. Question number 47. You suspect a head and neck injury in a victim who is unresponsive and not breathing. How would you open the airway to give breaths? Answer: jaw thrust technique. Question number 48. A person who is unconscious, not breathing, has a weak pulse, needs. Answer: rescue breathing. Question number 49. When dealing with an unconscious casualty, we should check up to dash for normal breathing. Check up to dash for normal breathing. Answer: 10 seconds. Question number 50. When a victim is not breathing, answer: close his nose and give 2 airflows on his mouth. Question number 51. What treatment does the victim who is life-threatening condition is not breathing need? Answer: you should follow the steps for rescue breathing. Question number 52. In order to initiate CPR on a drowning victim, answer: begin mouth-to-mouth ventilation. Question number 53. When you give airflow on mouth, make sure answer is chest rise. Question number 54. You are taking blood pressure by palpation. A radial pulse indicates a blood pressure of at least, answer, 110 mmHg. Question number 55. If the patient pulse cannot be felt at the wrist, where it should be felt next? Answer: at the carotid artery. Question number 56. Where is the carotid artery located? Answer: on the neck to the right or left of the windpipe. Question number 57. Check the carotid artery for a pulse on, answer, side of his neck. Question number 58. The pulse point located in the upper portion of the thigh is called the, answer, femoral. Question number 59. You have a casualty who is not breathing but has injuries to face that prevent you from performing mouth to mouth. What do? Answer: continue with compression only resuscitation at the rate of 100 to 120 beats per minute. Question number 60. What is the ratio of compressions to breaths when performing cardiopulmonary resuscitation in brackets CPR? Answer: 30 compressions is to 2 breaths. Question number 61. During one rescue CPR for adults, the ratio of compressions to ventilations should be. Answer: 30 is to 2. Question number 62. Which of the following correctly describes the CPR technique for an adult? Answer: 4 cycles of 2 breaths and 15 compressions per minute. Question number 63. Infant CPR is administered to any child under the age of. Answer: 12 months. Question number 64. When performing infant CPR and rescue breathing, what kind of breaths should you give to avoid forcing air into the infant's stomach? Answer: slowly and gently. Question number 65. On an infant, where would you check the pulse? Answer: inside the arm, between the elbow and shoulder. Question number 66. When performing CPR on a child, how deep should the chest compression be? Answer: 1.5 inches. Question number 67. On an infant, if you are the lone rescuer, you should perform compressions. Answer: using 2 fingers just below the nipple line. Question number 68. Where would you check the pulse on a 12-year-old boy? B. At the side of the neck. C. On the inside of the wrist. Answer: both B and C. Question number 69. When performing CPR on a child, you give. Answer: 2 slow breaths and 15 chest compressions. Question number 70. What is the CPR procedure for a 6-year-old boy? Answer: 15 is to 2, 4 cycles in 1 minute. Question number 71. An unconscious casualty is lying on their back and has a broken leg. What position is best for the casualty? Answer: lying down with the legs raised. Question number 72. Mouth to nose respiration should be used only when it is impossible to. Answer: if the mouth is severely injured. Question number 73. When you are giving mouth to nose AR, you should. Answer: hold the casualty's mouth closed. Question number 74. Where should you place your fist on the casualty in the CPR? Answer: middle of the sternum. Question number 75. When performing CPR on an adult, how deep should the chest compression be? Answer: 2 inches. Question number 76. What is the proper rate of chest compressions in CPR? Answer: 100 per minute. Question number 77. In order to initiate CPR on a drowning victim, answer: begin mouth to mouth ventilation. Question number 78. Difficulty breathing may be a sign of A. Heart attack, B. Asthma attack, C. Anaphylaxis. Answer: D. All the above. Question number 79. What damage could occur if first aider's hand is placed on the tip of the sternum during heart compression? Answer: the ribs might be cracked. Question number 80. The most critical factor in defibrillation is? Answer: the time from collapse to defibrillation. Question number 81. What is the first step in using an AED? Answer: turn on the AED. Question number 82. The AED will shock a patient. Answer: in ventricular fibrillation. Question number 83. If an AED is available but does not have child pads or child energy setting, what should you do for a 6-year-old non-responsive victim? Answer: use the AED and adult pad. Question number 84. When using an AED on a patient who is wearing a pacemaker, place the electrode pads. Answer: at least 1 inch away from pacemaker. Question number 85. You have shocked a casualty and there are signs of circulation. You should. Answer: leave the AED attached to the casualty. Question number 86. What is fainting? Answer: a brief loss of consciousness. Question number 87. Fainting happens when? Answer: brain did not get enough blood. Question number 88. When you feel fainting, answer: you should sit down with head between knees or lie down. Question number 89. The secondary assessment of the patient consists of a head to toe examination and a check of the? Answer: vital signs. Question number 90. A rapid body survey should take no longer than? Answer: 30 seconds. 91. Question number 91. Your check of the scene suggests that a victim has suffered an electrical shock. The first thing to do is? Answer: make sure the power is turned off. Question number 92. After removing victim from electrical shock, A. lay down on flat surface, B. check for breath, C. check for pulse. Answer: D. all the above. Question number 93. The emergency responder should assume a head spinal injury in any unwitnessed situation where the patient is answer unresponsive. Question number 94. Which is not a symptom of heart attack? Answer red, hot or dry skin. Bleeding. Question number 95. How can you reduce the risk of disease transmission when caring for open bleeding wounds? A. Wash your hands immediately after giving care. B. Avoid direct contact with blood. C. Use protective barriers such as gloves or plastic wrap. Answer D. All of the above. Question number 96. Signs of head and spine injuries are: answer blood or other fluids in the ears or nose. Question number 98. You feel a sudden sharp pain in the bottom of your left foot. You look at the bottom of your left shoe and see a tack sticking in your shoe. What type of wound do you probably have? Answer puncture wound. Question number 99. Responders involved in wound management should consider: answer all open wounds are contaminated to some degree. Question number 100. Dressing and bandages are used to: answer help control bleeding and prevent infection. Question number 101. An abrasion is: answer a scrape or rubbing away of the epidermis. Question number 102. A wound where there is damage to the soft tissue and blood vessel under the skin is called: answer a bruise. Question number 103. A soft tissue injury resulting from the impact of a blunt object is called: answer a contusion. Question number 104. To prevent further contamination and infection of a wound, you should cleanse the surrounding skin by: answer wiping away from the edges of the wound. Question number 105. What do you do for small cut? Answer wash with soap and water, cover with a sterile bandage. Question number 106. What is the best way to control bleeding? Answer direct pressure. Question number 107. Which should be part of your care for a severely bleeding open wound? Answer apply direct pressure and elevate the injured area, in brackets if no broken bones. Question number 108. What do you do for a crew who has a bleeding injury to the mouth and you are sure that there is no head, neck or spinal injury? Answer keep crew seated with head slightly tilted forward. Question number 109. A blood-soaked dressing on the arm indicates the bleeding has not yet been controlled. You should now: answer place a clean dressing on top and apply more pressure. Question number 110. Pressing on a fingernail, fingernail bed to observe the return of normal color is done to check for answer normal blood circulation to that part. So, pressing the fingernail bed is called capillary refill. Question number 111. A crew on your ship has a severe cut in the groin area. What do? Answer. Cover the wound with a sterile dressing, applying direct pressure. Question number 112. For heavy bleeding, you need to apply pressure point to reduce bleeding. Answer. Yes. Question number 113. You can apply pressure on major artery supplying blood to control bleeding. Answer. Yes. Question number 114. You have tried to control a victim's bleeding with direct pressure and elevation, but the bleeding does not stop. Where would you apply pressure to slow the flow of blood to a wound on the forearm? Answer. Inside the arm, between the shoulder and the elbow. Question number 115. Which artery's pressure point is located on front of upper leg just below the middle of crease of groin? Answer. Femoral artery. Question number 116. Severe bleeding is a hurry case. Which one of the following statements is true? Answer. Try to avoid direct contact with the victim's blood by using latex gloves or other barriers. Question number 117. Which of the following is true when treating an eye injury? Answer. If an object penetrates the eye, you should bandage or tape the object in place. Question number 118. You discover a particle embedded in the casualty cornea. You should answer. Cover the eye and transport the casualty for medical help. Question number 119. When caring for victim who has an object impaled in their hand, you should answer. Immobilize the object by placing several dressings around it. Question number 120. A victim has a large piece of glass sticking out of her leg. You should A. Leave the glass in her leg and control the bleeding. B. Call your local emergency phone number. Answer. D. Both A and B. Question number 121. What should you do for a person with an object like a knife stuck in their leg? Answer. Call medical help, control bleeding, and stabilize the object in place. Question number 122. Tourniquet can be used for first resort to stop bleeding. Answer. No. Question number 123. Tourniquets can be removed as soon and removed as and when necessary. Answer: no, it should not be removed. I beg your pardon. No, it should be removed by doctor. Question number 124. Is it advisable to cover the tourniquet with clothes or bandages? Answer: no. Question number 125. To prepare a completely amputated part of the body for transportation to a hospital with a casualty, you should: answer: wrap it in clean, moist dressings and keep it cool. Question number 126. What would you do if a victim had a body part torn or cut off? A. Wrap severe body part in sterile gauze. B. Place in a plastic bag. C. Put the plastic bag on ice and take it to the hospital with victim. Answer: D. All of the above. Question number 127. What steps would you take to control bleeding from a nosebleed? Answer: sit casualty down, lean forward, pinch soft part of nose. The accepted, question number 128, the accepted treatment for a nosebleed. Answer: have the victim lean forward, apply gentle pressure on the nostril, apply cold towels. Question number 129. When caring for victim with a bloody nose, you would not: answer: have the victim sit with head tilted slightly backward while pinching the nostrils together. What position, question number 130, what position should the head be in during a nosebleed? What position should the head be in during a nosebleed? Answer: head forward. Question number 131. Internal bleeding can be caused by A. injury, B. illness, C. medication. Answer: D. all of the above. Question number 132. What symptoms would indicate internal bleeding? A. rapid weak pulse, excessive thirst. B. skin that feels cold or moist or look pale or bluish. C. tender, swollen, bruised or hard areas of his body such as abdomen. Answer: D. all of the above. Question number 133. A victim is coughing up blood with bleeding from the mouth and is tender in the abdomen. Pulse is weak and rapid. The victim is having signs of: answer: internal bleeding. Question number 134. What should you do if you think that the victim has serious internal bleeding? Answer: call for medical assistance as quickly as possible. Question number 135. When a victim is having neck injury, answer: hold his head. Question number 136. Which should not be a treatment for a person who has received a head injury and is groggy or unconscious? Answer: give a stimulant. Question number 137. You are alone and must remove a casualty with a suspected spinal injury from a very hazardous situation. You should: answer: grasp his clothing under his shoulders, support his head and neck, and drag him lengthwise. Shock. Question number 138. Shock is best defined as answer inadequate circulation to the body's tissues. Question number 139. Shock is a condition where answer the cardiovascular system fails to deliver blood to the heart. Question number 140. Shock is a condition where answer the cardiovascular system fails to deliver to all parts of the body. Question number 141. The symptom of shock includes A. Low blood pressure, B. Rapid shallow breathing, C. Rapid weak pulse. Answer D. All of the above. Question number 142. A victim has lost a lot of blood through a deep cut in his leg. He is breathing fast and seems pale and restless. He is probably answer in shock. Question number 143. The most important step in managing shock is to answer give first aid for the illness or injury. Question number 144. The most immediate serious complication associated with burns is answer shock. Question number 145. Hypovolemic shock results from answer decreased volume of the blood. Question number 146. The type of shock that is caused by a severe infection is called answer septic shock. Question number 147. Some people are very allergic to insect bites and stings. This condition is called answer anaphylactic shock. Inadequate pumping of blood by the heart gives rise to answer distributive shock. Question number 148. Question number 149. In a shock, answer do not give anything to a patient with impaired consciousness. Question number 150. The onset of shock in infants and children answer usually results from cardiac problems. Question number 151. Which is not a symptom of shock? Answer chest or abdominal pain, breathing difficulty. Burns and scalds. Question number 152. The external layer of the skin is called answer epidermis. Question number 153. A first degree burn answer involves only the top layer of skin. Question number 154. To treat first degree burn, you should answer apply cool running water until there is little or no remaining pain. Question number 155. A burn should be immersed or placed under water for at least dash minutes. Answer 20. Question number 156. You are caring for victim with a burned hand. Put the hand on cold water if. Answer, the burns are minor with no open blisters. Question number 157. For first degree burns, you can use salt water. Answer, no. Question number 158. Which of the following includes the top layers of skin and involve blistering? Answer, second degree burn. So, first degree burn symptom is redness, second degree burn symptom is blisters, third degree is charring, 3 layers of the skin. Question number 159. For second degree burns, we can break the blister. Answer, no. Question number 160. On second degree burn, if 15% of body is affected, take the victim to hospital. Answer, yes. Question number 161. Treatment for burns and scalds depends on the severity of the injury. What is the correct thing to do for minor burns and scalds? Answer, place the injured part under slowly running cold water for at least 10 minutes, but preferably until the pain is gone. If no water is available, use any cold harmless liquid like milk, juice, etc. Question number 162. What should be your first concern at the scene where a person has been seriously burned? Answer, checking the scene for safety. Question number 163. In determining the amount of body surface burned, the area of the palm of the hand represents %, of the body surface. Answer, 1%. Question number 164. Why should you cover burns with a clean or sterile dressing? Answer, to prevent infection. Question number 165. What is the first thing you should do for someone you suspect as an electrical burn? Answer, check to see if electricity is turned off. Question number 166. When caring for someone who has suffered an electrical burn, you would not. Answer, cool the burnt area. Question number 167. What do you do for a chemical burn? Answer, flush with large amounts of cool water until help arrives. Question number 168. What names are given to the 3 different depths of burns? Answer, first, second, third degree. Question number 169. To flush an eye that has been exposed to a chemical, have the injured eye lower than the unaffected eye. Answer: true. Question number 170. Toxic substances can affect the body in following ways: A. Through the lungs, B. Through the skin, C. Through the eye. Answer: D. All of the above. What is the proper treatment for frostbite? Answer: warming exposed parts rapidly. Question number 172. First aid for the frostbitten are: A. Give some hot coffee, B. Give some hot tea, C. Give some alcohol. Answer: D. Nothing above. Question number 173. If a person receives third degree burns, A. Do not cool with water unless it is a chemical burn. B. Do not bandage the burn tightly. Answer: C. Both A and B. Question number 174. White or greyish yellow patches on someone's ears, noses, or cheeks are sign of. Answer: frostbite. Question number 175. Can you massage the frostbitten skin? Answer: no. Question number 176. Why smoking is not allowed for frostbitten effect? Answer: smoking contracts blood vessel in the skin and slows the healing process. Question number 177. When caring for someone who is suffering from frostbite, you should not. Answer: rub vigorously until skin appears red and feels warm. Heat related illness is mostly for MFA, but sometimes they do ask in the EFA also. Question number 178. What symptoms are associated with heat exhaustion? A. Cool, moist, pale or flushed skin. B. Rapid, weak pulse. C. Rapid, shallow breathing. Answer: D. All of the above. Question number 179. Signs of heat exhaustions are: A. Fatigue, B. Weakness, C. Collapse. Answer: D. All the above. Question number 180. The symptoms of heat exhaustions are: Answer: pale and clammy skin. Question number 181. First aid for heat exhaustion are: A. Move him out of heat. B. To drink lot of water. C. To drink sports drink. Answer: D. All the above. Question number 182. Which of the following should be done for a person experiencing a heat related illness? Answer: apply cool, wet cloths. Question number 183. A girl is unconscious. She is heavily dressed and her skin is reddish, dry and hot. What should you do? Answer: check for breathing and pulse, call medical help, get the girl out of heat, loosen tight clothing and cool her off any way you can. Question number 184. Heat stroke person has very high internal body temperature. Answer yes. Question number 185. Heat stroke is more severe form of heat stress. Answer yes. Question number 186. Cool the heat stroke person until his temperature comes to. Answer 100 degree Fahrenheit. 187. In which situation would you wrap a casualty in a cold, wet sheet? Answer heat stroke. Question number 188. Heat stroke A causes very high body temperature. B. Hot, red or dry skin. C. Rapid, weak pulse, shallow breathing. Answer D. All of the above. Question number 189. Heat stroke person should be cooled immediately. Answer yes. Choking. Question number 190. If a person is choking, you should do nothing as long as answer they are coughing. Question number 191. Which of the following is a sign of severe airway obstruction? A. Forceful cough. B. Wheezing. C. High pitch inhalation noise. Answer D. All of the above. Question number 192. Increased respiratory difficulty accompanied by a weak, ineffective cough, wheezing, high pitched crowing noises, and cyanosis are signs of. Answer severe airway obstruction. Question number 193. Heimlich maneuver used for. Answer choking. The other name is abdominal thrust. Question number 194. A shipmate chokes suddenly, cannot speak, and starts to turn blue. You should. Answer perform the Heimlich maneuver. Question number 195. An 8-year-old child is unconscious and the airway is blocked. You should. Answer give abdominal thrust. Question number 196. When performing abdominal thrust, how many thrusts you do? Answer 5 thrusts. Question number 197. When helping an unconscious choking victim, you would give an adult dash chest thrust. For an infant, you would give dash back blows and dash chest thrust. Answer 555. Question number 198. For an infant who is choking, you would perform. Answer back blows and chest thrust. Question number 199. When caring for a choking infant, what position is the infant held? Answer face down on your forearm with head lower than the body. Fracture. This is also MFA topics. Sometimes they ask questions. Question number 200. A crew member has fallen from a height of about 5 meters and though cannot feel any pain in his limbs, what should you do? Answer: do not move the patient as he may have neck or spine injury. Question number 201. You should suspect that the victim has head and spine injuries for an accident involving a lightning strike, B. a person found unconscious for unknown reasons, C. a fall from the height greater than the victim's height. Answer: D. all of the above. Question number 202. Signs of broken bones are: A. sound of bone snapping, B. bone with strange appearance, C. bone poking through skin. Answer: D. all of the above. Question number 203. Symptoms of broken bones are: A. swelling area, B. dislocated area, C. pain when touched. Answer: D. all the above. Question number 204. Simple fracture is: Answer: broken bone that does not pierce the skin. Question number 205. What is an open fracture? Answer: a fracture in which the bone is exposed as the skin is broken. Question number 206. Splint an injury to a muscle, bone or joint only when A. you have to move or transport the victim, B. you can do so without hurting the victim. Answer: C. both A and B. Question number 207. What are splint made of? Answer: clean plastic. Question number 208. In general, you can shift the victim before splinted for the broken bone case. Answer: no. Question number 209. When a victim is having neck injury, answer: you should not tilt his head. Question number 210. If you suspect a head or neck injury, answer: support the head and neck in the position found. Question number 211. When managing a possible spinal injury, answer: responders must provide initial stabilization by supporting the head and ensuring neutral alignment. Question number 212. You find a person at the bottom of the stairs. He appears to have fallen and seems badly hurt. After sending someone for help, you would, answer: attempt to keep the victim from moving. Question number 213. Signs of sprains are: answer: swelling. Question number 214. Signs of sprains are: A. swelling, B. tenderness, C. discoloration. Answer: D. all the above. Question number 215. Ice packs on sprain helps. Answer: reduce the swelling. Question number 216. What is ICE an abbreviation for? Answer: ice compression elevation. Question number 217. The accepted treatment for a sprained ankle is: answer: keep the shoe on, apply an ankle bandage for support, elevate and apply cold towels. Question number 218. Elastic bandages are used. Answer: control swelling and support injuries such as sprains or strains. Question number 219. Strain is due to. Answer: muscle soreness. Question number 220. Strain is due to. Answer: muscle tearing. Question number 221. Treatment for strain. Answer: rest and heat. Question number 222. For sprain you can use ice packs. Answer: yes. Question number 223. What is the name of the stretcher often found on board? Answer: the Neil Robertson stretcher. Stroke. This is also MFA topic. Sometimes you get questions. Question 224. Stroke is caused by. Answer: blood clot entering the brain. Question number 225. Which of the following signs is most consistent with a stroke? Answer: facial drop. One side of the face will drop. Question number 226. Stroke is the. Answer: brain injury. Question number 227. A conscious casualty who has suffered a stroke becomes unconscious. To keep his airway open and help him breathe, you should. Answer: turn him into the recovery position with his unaffected side down. General topics. Question number 228. A woman has fallen and turned her ankle. She says she heard something snap. She looks pale and is sweating. What should you do? Answer: care for the injury as if it was serious. Question number 229. To safely perform a chair carry, you need. Answer: two rescuers. Question number 230. Which one of the following changes in vital signs is characteristics of brain injury? Answer: increase in blood pressure. Question number 231. A child has swallowed an unknown poisonous substance. You should. Answer: call your local poison control center and follow directions. Question number 232. When handling a knocked out tooth, you should. Answer: place the tooth in a cup of milk. Question number 233. Irrigate eyes with. Answer: saline solution. Question number 234. Can you use neutralizing agent for cleaning eyes? Answer: yes. Question number 235. Asphyxia occurs when a person cannot get enough. Answer: oxygen. Question number 236. If the victim has consumed pesticide or chemical, then. Answer: follow instruction as per cargo information sheet or material safety data sheet, MSDS. Question number 237. What method of manhandling type you use if crew is unconscious? Answer, fireman lift. Question number 238. What is the most important thing to do if you think someone is having a heart attack? Answer, call medical help. Hypothermia. Question number 239. What are the symptoms of hypothermia? Answer, cold, tired, shivering, and acting abnormally. Question number 240. Which of the following increases the risk of hypothermia? A. Old age. B. Very young age. C. Use of alcohol. Answer, D. All of the above. Question number 241. Which procedure should be followed when individuals are rescued in cold climates and suffer from hypothermia? Answer, move them to a warm room to gradually raise their body temperature. Question number 242. The primary symptom of the advanced stages of hypothermia requiring immediate medical attention is violent shivering. Answer, true. There are a number of questions ending with the word require. Answers for such questions are doctor's advice. I am going to give a long list. Watch them. Question number 243. Burns on face require. Answer, doctor advice. Wherever the question is ending with require, it is you select the choice of answer as doctor advice. Require, doctor advice. Question number 244. Drowning treatment require. Answer, doctor advice. Question number 245. Severe allergic reactions require. Doctor advice. Question number 246. Severe head injuries require. Doctor advice. Question number 247. Eye injuries require. Doctor advice. Question number 248. Severe shock require. Doctor advice. Question number 249. Spinal injuries require. Doctor advice. Question number 250. Smoke inhalation requires. Doctor advice. Question 251. Severe allergic reactions require. Doctor advice. Question number 252. Open abdominal wounds require. Doctor advice. Question number 253. Drowning treatment requires. Doctor advice. Question number 254. Open chest wounds require. Doctor advice. Question number 255. Poisoning require. Doctor advice. Question number 256. Burn on the face require. Doctor advice. Question number 257. Excess bleeding require. Doctor advice. Question number 258. Cardiac problems require. Doctor advice. Question number 259. Electrical shock victims to be seen by doctor. Yes. Question number 260. Heavy bleeding should be treated by doctor. Answer is yes. So, with that, the consolidated EFA question bank questions and answers are over. So, it is a 50 rupees challenge. So, on completion of remembering all the answers and passing your exam, you can remit 50 rupees using my QR code. Thank you. And this is the book I published for nautical students and nautical officers, available in Amazon Kindle store for rupees 100. E-book. For those appearing for GMDSS examination, all the practical equipments used in GMDSS examination, I had given 19 videos for all the equipments with my voice, so you can go through them. These are all the advertisement from Pondicherry Maritime Academy. You can make a note and book your seats online. Pondicherry is a nice place. PME is a very good institution where young chief engineers and masters come and take classes. You get up-to-date knowledge. The instructors there have years of experience, and the academy is located in a pollution-free area. No sound pollution, no smoke pollution. So you can give the like, bell buttons, subscribe. You must give the comments in the YouTube. This is my WhatsApp number. There also you can send your comments. Thank you very much. Until next consolidated video.